Short case on jaundice in a young female 16 years. Introduction. Good morning, afternoon, sir. This is a 16-year-old female presenting with jaundice for the past 2 weeks. I will conduct a focused general physical and abdominal examination. General physical examination. Inspection. Yellowish discoloration, checks scleral skin, and mucous membranes under natural light. Look for scratch marks, pruritus in cholestatic jaundice. Nutritional status. Malnourished appearance may suggest chronic illness. Signs of chronic liver disease. Spider angiomas, palmar erythema, or clubbing. Hands and nails. Check for clubbing, chronic liver disease. Leukonychia, hypoalbuminemia. Look for flapping tremors, hepatic encephalopathy. Eyes. Examine conjunctiva for pallor anemia. Check sclera for jaundice. Mouth. Inspect for angular stomatitis, glossitis, or bleeding gums, vitamin deficiencies. Lymph nodes. Palpate for enlarged lymph nodes suggesting lymphoma or infections like EBV. Pay special attention to the left supraclavicular lymph node, Verco's node. Abdominal examination. Inspection. Look for abdominal distension, visible veins, or scars. Observe for hepatosplenomegaly signs. Palpation. Liver. Palpate the liver edge for size, consistency, and tenderness. Check for nodularity, suggests liver disease. Spleen. Check for splenomegaly, suggestive of hemolytic or infectious causes. Percussion. Assess liver span and any signs of ascites. Auscultation. Listen for hepatic brute, rare in tumors or vascular disorders. Differential diagnosis. 1. Infective causes, viral hepatitis A, B, C, malaria, leptospirosis. 2. Hemolytic causes, autoimmune hemolytic anemia, G6PD deficiency. 3. Congenital causes, Gilbert's syndrome, Wilson's disease. 4. Obstructive causes, gallstones, biliary atresia, rare in young age. Key points to pass. Be systematic and confident in presenting findings. Relate clinical signs to your differentials. Use bedside manners, be polite, and ensure patient comfort. Be ready to discuss investigations, LFTs, ultrasound, viral markers, and hemolysis workup. Conclusion. I have completed the examination. I would like to proceed with relevant investigations to confirm the diagnosis and guide management.